when I started with Podiatry, first I didn't have foot scales. So before I ordered a foot, I just measured the mark on the paper and then I measured the length and width. But when I ordered, it turned out to be a bigger size than what I had. So I had taken a foot scale. Now I am very confidently what size of foot and shoes to be advised to the patient, and also what to order and what size of insole is to be advised.
What financial part you got?
Financially also good. Initially I was not charging for consultation. Then sir said, when you're taking so much time, almost 1 hour, more than 1 hour I used to take for one patient to examine. But after foot scale it made me easy. So half an hour, 45 minutes more than. Now I take only half an hour with the examination, assessment and consultation, everything. And I charge patient also.
So you're getting financial profit?
Yes.
Whatever you have invested, you got return?
Yes. I actually got profit also. Consultation charges is also giving me.
And patient giving satisfaction?
Mainly patient satisfaction gave me more confidence, because patient gave me immediate responses like, no, I can walk properly, the pain is immediately gone, I am balancing myself. And the difference in the picture also, pre and post, immediately I can see it and I have to show to the patient. I show them, see, this is the difference and this is immediate difference, and how much difference you will get in 2 weeks when you do all the exercise which we are doing it in the clinical OPD at present. So when they practice, they get more confident, they do exercise at home also, wearing the insole and footwear both.
Thank you.